Hi, I'm Dr. Daniela Steyn. I just had a patient with me here in my clinic. So I have a wellness clinic. It's lifestyle medicine, functional medicine. I have a clinic here in Oakville. And I just had a patient come to me with low homocysteine levels. So it's not very common that we see low homocysteine. And I explained it to her very nicely. I took half an hour to explain it to her. I'd like to explain it to you. So I sometimes need to test homocysteine levels. It's not something we test very commonly. You might have had your patients, um, or you as a patient might have gone to your doctor, and your doctor might have said, "Oh, they need to test your vitamin B levels." So usually our first thing that we test is vitamin B. And only then, once we tested vitamin B, and if there is anything abnormal with your vitamin B, that's only when we'll test for homocysteine, generally, for most people. So in hospital, I see quite a lot of sick people. I see people on chemotherapy, cancer people. So I test things more often, maybe, than your family doctor would. So I sometimes need to test homocysteine levels. If your doctor asks you to go for blood work and your doctor say that you need homocysteine checked, this is why. So then you can watch this video if you're like Googling homocysteine and you think, okay, why should I be going for this? I'm going to explain to you this is why your doctor is testing this. So homocysteine is an amino acid that you have in your body. Vitamins like vitamin B12, vitamin B6, and folate will break down your homocysteine, and it breaks it down to create other chemicals that your body needs. So if your blood work comes back with high homocysteine levels, it might mean that you have a vitamin deficiency. So typically where I work in a big hospital, we have a cardiac unit. We often have people with heart disease, heart attacks. I work on our stroke unit. We've had people with stroke. Quite often I will see that their homocysteine levels would be high. So if your homocysteine levels are high, something quick and easy that you can do first thing is if you smoke is to quit smoking. That's going to bring your homocysteine down right away. If you eat too much salt, you can cut back on your salt intake. If you what else? Oh, if you have a vitamin deficiency, for sure. If you increase your vitamin B6, B12, folate, that will help to bring down your homocysteine. If you continue to have an elevated homocysteine level, this might really increase your risk of having a stroke, a heart attack, dementia. So it is important from my perspective as a doctor that people should have optimal or low levels. Then if you when if you are interested from a scientific level, if your homocysteine interact with vitamin B vitamins, then that homocysteine gets converted into two substances. The one is methionine, that's an essential amino acid, and antioxidants, which makes proteins. And then the other one it gets broken down is to cysteine, and that's a non-essential amino acid. If you're interested, the difference between essential and non-essential is essential amino acids are things that you need to get from your food. Your body can't make it. That's methionine. Non-essential would be something like cysteine. That's an amino acid that your body can produce on its own. So the reason why cysteine is important for you, for me, for my patients, is because it reduces inflammation. So inflammation is key. Inflammation is what drives heart disease, cancer, autoimmune diseases, dementia. You want to reduce inflammation. You'll see a lot on my website blogs. There's now a great blog by our nutritionist Bonnie Flemington where she talks about anti-inflammatory diet, how to reduce your inflammation through food. We can reduce inflammation through stress management. We can reduce inflammation through exercise. There are different ways that you can reduce your inflammation. Cysteine is key for your body to reduce inflammation. Um, so What it also does is it increases communication between your immune system and your liver. Very important. So most commonly in hospital, when I test someone and their homocysteine levels are high, so your normal, the values in Canada and in the US, we measure it in different in different countries. So just wherever you are, check with your own healthcare provider. In Canada and in the US, our normal is between 5 and 15 micromoles per liter. So if you have more than 50, so normal is 5 to 15, 1.5. If you have more than 50, 50, then we say it's excess. So we don't get excited if it's a little bit, but if it's above 50, we say that homocysteine can damage the lining of your arteries. That increases your risk of blood clots. That increases your risk of heart disease, stroke, dementia. We don't want it that high. The reason why it might be for people with pre-existing heart disease, I often see that their homocysteine is high, or people with low vitamin B, B12, B6, folate. And then sometimes I get it in patients that have a rare inherited disease. We call that homocysteinuria. That is where their body can't process methionine. Okay, so what's the risk of it being high? Does damage to the inside of your arteries, higher risk of heart disease and stroke. What is the problem if it's too low? We don't see it often. I see it often because I have a lifestyle medicine clinic, a wellness clinic. So people don't often have symptoms. Generally, people come to me for longevity before they have symptoms. We do a complete workup, then we pick it up. I also see it with children with cancer or children with diabetes, but then in some individuals that maybe can't process protein as well, I might see a low homocysteine. And I had a patient just now before this video, and that's why I quickly want to record it to explain to you if you have found that you have a low homocysteine and your doctor wasn't clear what to do with it. It's just because it's not something we commonly see. Your physician might not be concerned about. I am very concerned about it. I would say, so the reason is if your homocysteine is low, then your body has a decreased ability to methylate. You will have lower glutathione, and you need glutathione. You can have a look at my other blog posts, my other YouTube videos. You need glutathione as an antioxidant, and you need antioxidants to prevent heart disease, to increase your muscle strength, to prevent cancer. You need antioxidants to prevent autoimmune diseases. For every cell in your body, you need antioxidants to thrive, to do well. So how would you know if you need a homocysteine test? That's not generally a test that we test in everyone for everything. If you have known heart disease, you might want to consider that. If you have low vitamin B, you might want to consider it. The way you'll know you have low vitamin B is often when people have sores in their mouth, a burning tongue, that could be vitamin C or vitamin B deficiency. Some patients will come to me with dizziness or general muscle fatigue. Those would be reasons why I would test for vitamin B, or tingling, or someone looking pale. I have very white skin. I always look pale. Luckily, I'm tan because I just came back from holidays. But if someone comes to me and they just look a little bit too pale, a little bit off, that might be a reason why we would test for vitamin B. If the vitamin B is low and I want to try to get to the root cause, why would their vitamin B be low? Homocysteine would often be a test we could do. We often in diabetic patients, especially, or patients after chemo, radiation, would have peripheral neuropathy. People could have tingling. And even if you don't have diabetes, if you have tingling of your nerves, feet, arms, that might be a reason for us to test for you for vitamin B deficiency. And if your vitamin B is low, we'll next test for homocysteine. People with chronic inflammation, autoimmune disease, is good to test. So if your homocysteine is high, first we'll recommend a supplement with vitamin B6, supplement with B12 and folic acid. Then if you're smoking, stop smoking, lower your salt intake. Exercise has been shown. If you exercise 3 to 5 times a week, that will help to normalize your homocysteine levels. For people with a low homocysteine, we'll advise to increase your protein intake. I have many patients on antacids. an antacid will decrease the pH or increase the pH of your stomach, so decrease the acid in your stomach. So that will impair your body's ability to break down protein. You won't be able to absorb protein as well. Or if you have leaky gut, you can't absorb protein as well. Chew your food. If you're not chewing protein, you might not be able to absorb it as well. So increase your protein intake, make sure you absorb it well, and then increase your sulfur intake. That's critical. So sulfur you get in cruciferous vegetables. If you have a perfect diet, enough protein, enough cruciferous vegetables, you're eating lots of broccoli, bok choy, kale, you're eating all your healthy green veggies, you still have low homocysteine, you might consider a supplement of NAC or molybdenum supplements. But usually I go with lifestyle first. So if you really improve your diet, that's usually best case, what I would recommend. Thanks for watching. If you have any questions, you can just comment below, or you can email info@wellnessmdhealth.com. Any specific questions, you can let me know. Take care.